Hey friends, welcome back to now the 23rd edition of What the Facts? The most frequently asked questions about nutrition. Since it's October, I thought I would dedicate this video to a discussion about breast cancer. It is Breast Cancer Awareness Month. Now, men, don't leave because you can get breast cancer too. So stay tuned. Some of the same preventive measures for women can go for men. And furthermore, the same preventive measures may reduce your risk for prostate cancer. So don't go away. I'm going to provide you information that I borrowed predominantly from Dr. Kristi Funk in a couple of interviews that she gave on PCRM.org on YouTube, on the exam room, hosted by usually Dr. Chuck Carroll. But one of them was between her and Dr. Neil Barnard, who basically is the director of that whole site and YouTube production. Or rather, he's the main person behind it, the main doctor behind it. So let's get started. Dr. Funk mentioned about four different avenues, or four pillars rather, of attention here on how to reduce risk factors for breast cancer. The first was diet. Here we go again. Plant-based is what really matters. Eating many plants early and often, and making sure most of your calories come from plants as opposed to meat, egg, and dairy. The more meat, egg, and especially dairy you eat, the higher your risk factor for breast cancer. Now, actually, meat poses a comparable risk if you eat a lot of it because it tends to increase some growth factors. There's something called IGF-1, insulin-like growth factor. And meat also gives you another source of saturated fat and cholesterol. And those are the enemies of good health when it comes to avoiding many cancers, but especially breast and colon cancer. So avoiding the dairy products, especially the more fatted ones like ice cream and cheese, but really any dairy product tends to increase your risk. Also, processed sugars. There's a nice study that Dr. Funk reviewed that showed that I think it was about 16% increase for women that consume processed sugars versus those that get most of their sugar calories from whole foods. So keep that in mind. Diet plays a big role. Secondly, exercise. Steady exercise, or rather consistent exercise, is important. Somewhere around 25 to 30 minutes, at least 5 or 6 days a week. Make sure it involves significant cardio to get that heart pumping. But if you haven't been exercising and you're 40 or older, you should talk with your doctor to make sure there aren't some other things that need to be checked first. And definitely go gradual. Don't try to run a marathon if you've not even been running a block. You want to go gradual, but you want to make progress. So exercise is important. It helps to keep the weight down, which I'm going to get to. That's actually another pillar. So we said food, choices, exercise. The third thing is alcohol. Even moderate consumption of alcohol increases your risk for breast cancer. There are a couple of reasons that were highlighted in the interview. One was that alcohol tends to be broken down into something that can affect your genetic expression, your DNA, and make you at higher risk for breast cancer. The acetaldehyde is one of the metabolites of alcohol. The other thing is that it tends to create that imbalance of estrogen too. And people that tend to drink more regularly tend to be overweight. And if you're overweight, you have more adipose tissue. That's the more nice technical term for fat cells. And fat cells tend to take the testosterone that is made and turn it into more estrogen. And that happens in men too. So men that are overweight, you tend to have more estrogen floating around. And that's one reason why they can get man boobs. All right. So we talked about diet. We talked about exercise. We talked about alcohol, really cutting it out. They have these mocktails now that you can drink, but really X out the alcohol if you can. The fourth prong was keeping your weight down. How far down? there's something called body mass index, and you should try to keep it at under 25. Now, they say anywhere between 18.5 and 24.5, something like that. But I think probably you should shoot a little lower, around closer to 23, to be really healthy. But you got to get it down under 25. So those are the 4 prongs. Now let me drill back a little bit on food. So to have a balanced plant-based lifestyle, you want to have your fair assortment of greens, leafy greens. Now the cruciferous vegetables really hold a lot of weight, so to speak, because they have those ingredients that are so high in antioxidant value, especially broccoli. I mean, she really goes to town verbally on broccoli in the interview because of those sulforaphanes that are antioxidant, and they help to remove the liver, to reduce toxins. They're anti-inflammatory. And so she goes into much detail about that. So broccoli really matters. But there's also kale, loaded with vitamins and minerals and all kinds of antioxidants too. And there's Brussels sprouts and cauliflower. Really, choose whatever ones you really like and eat them early and often. That's just one quadrant. There's also the fruit, and she says those berries really count. They're very antioxidant. They don't give you insulin spikes. So the berries, blueberries, blackberries, strawberries. If you can, you should go organic with them. They tend to be pasted with a lot of insecticides and pesticides. But if you can't, just wash them well and go at it. And then the other quadrant, the upper right quadrant in our plate, are the whole grains. And then the lower right quadrant are the beans. Now, she focuses on a couple of different, or a few supplements. One was flaxseed, ground flaxseed, because in that you get fiber and you get some components called lignans that are really anti-cancer. She reviewed a study that showed that people that had the ground flaxseed with all those lignans did so much better in dealing with either diagnosed cancer or preventing cancer. I can't remember. It's one of those. But I've heard and seen other reports about the value, the power of ground flaxseed. She also said that turmeric, that's a very, very good anti-inflammatory supplement. And we did a little sprinkle of pepper there, turmeric in your stew or your soup or your smoothie. It makes things very yellow. Did you know that's what makes mustard yellow? Turmeric. But anyway, it's talked about a lot in the nutrition reports, and so I think she mentioned that. And let's see, vitamin D, making sure your vitamin D levels, you should get that checked annually. They should be not low normal. They should be right up there in the middle or towards the high. You don't have to be above the upper limit of normal, but it helps to really have a good, solid vitamin D level. And if you're plant-based, you definitely need to take supplemental B12. All right, I think I covered most of what I wanted to cover. She does highlight that only about 5 to 10% cancers are genetically driven, so don't be dismayed if, your mother had it or another relative, because yes, it does increase your risk, but lifestyle and diet can change the expression of genes so you can be in control. So get motivated, get moving, and do the things you need. Make sure you have your breast cancer screenings like you should, based on your doctor's recommendation. Have regular appointments with your doctor. Do some self-testing. And make sure you follow whatever your doctor's guidelines on how often you should be screened and what the screening procedure should be. All right, that's about it. I guess the outgoing tip of the week would be that make sure that if you are a coffee drinker, that you are not tainting your coffee by putting sugar in it, processed sugar, or artificial sweeteners in it, because that's bad for the microbiome, or any of those little creamers, or agave nectar. That's a lot of fructose. All those things are bad, for, for your health. And they really take you 2 steps backwards from what you accomplished when you Drink coffee. Coffee is a bean. It has some antioxidant properties. So don't taint your coffee. Oat milk or soy milk is fine. And one more tip, soy is just fine. Soy reduces your risk for breast cancer. There's some evidence it reduces risk for men in prostate cancer. A great source of, another source of calcium, a source of fiber, can lower your cholesterol. So soy products are fine, especially the ones that aren't highly refined, like the isolate soys that are in some of the fake meats and things like that. Those aren't so good. But tofu, tempeh, miso, those soy milk, check the labels so there's not added sugar, stuff like that. But soy is good. All right, folks, check me out on my website at fearlessmd21.com when you get a chance. And like this video, subscribe if you haven't. I'll be right back at you in another week or two. Take care.